Well, a 6-week pilot study reducing the amount of space between students within Kent County schools from 6 feet down to 3 feet.
It applies only to pre-K through 8th grade classrooms and hopes to curtail over quarantining. Fox 17's Marisa Oberly has a closer look.
Washing hands and wearing masks. It's part of the routine for students in Michigan. But for those within Kent County schools, staying 6 feet from one another is no longer the new normal.
We want to keep them safe from having an infection from COVID, but we also want to keep them in school.
Joanne Hoganson is the director of community wellness for the Kent County Health Department. Her team is working alongside area schools to pilot a study that cuts social distancing in pre-K through 8th grade classrooms in half to 3 feet. After data showed little transmission within schools, they started 3 weeks ago.
We have not seen a spike in cases in positive tests among school-age children. And so that's a very good sign that tells us we're not seeing more transmission.
The goal is to keep students in school by reducing over-quarantining. Before the change, anyone within 6 feet of a positive person for more than 15 minutes would be required to stay home for 10 days, infected or not.
If you have a 7-year-old child and all of a sudden you get a phone call that they're fine, but they were close to another child who had tested positive and they need to stay home for many days in a row, and you're given essentially just a few minutes notice and you need to come pick up your child from school, we know that's extremely disruptive.
Beam believes compliance with quarantines will increase as a result. The change goes against current CDC guidance. However, a study published last week found if schools continue to follow other safety practices, there is no significant difference between the two distances. The American Academy of Pediatrics also recommends 3 feet, and if a student tests positive, quarantine is still required for the close contacts.
Most children learn best in a school setting, and most children are going to have their needs met when they're in a school. They're going to have a good, healthy lunch. They're going to have the eyes of a teacher on them.
Stay vigilant. We're close to the end of this. These are some of these tweaks that we make to make this whole experience marry up with the science that is evolving.
In Grand Rapids, Marisa Oberly, Fox 17 News.
And the health department says barring any increase in cases linked to schools, this policy will remain in effect once the study ends in 3 weeks. It may also expand to high schools after spring break.